Hey, what's up, Feral on Ambulance Corps? It's John Barr back again for episode 14. This time we're going to do another disaster medicine topic, bioterrorism. So without further ado, let's get right into it. Take a moment to read the usual disclaimer here. Alright, so today I'm going to review some of the history of biowarfare, talk about some of the agents of concern, and how you might recognize them. So I want you to consider this hypothetical scenario. As you guys know, we have a presidential election this year. Things are heating up a little bit. And you notice, like, right around the week of the election, you're getting a lot of calls to local restaurants, people getting nauseous, vomiting, having diarrhea. You're getting calls to people's houses for diarrhea. Everyone in Fairlawn seems to be coming down with this diarrheal illness. It just seems a little odd to you. And not only that, you're seeing like younger and healthier people getting sick too. And these people all get taken to the hospital. They're seen by an ER doc like me. I start to notice the trend. Other docs start to notice the trend. And we'll make a long story short, after some further workup, it turns out that everyone had salmonella. And it turns out that a political terrorist group had essentially poisoned the salad bars at a number of different restaurants to sicken people so that they wouldn't go out and vote. And so I want you to take a moment, think about that scenario, think about how plausible it might be. At a glance, it might sound far-fetched, but in reality, this actually happened in 1984. And this was actually the largest bioterror attack in United States history. There was an Nishi bioterror attack where over 751 people were infected with salmonella. Now, fortunately, while a lot of people got sick, not a lot of people died. But I bring up this scenario just to illustrate that bioterror attacks, they don't have to be the Ebolas and the anthraxes. They can be simple pathogens like salmonella that could accomplish the group's purpose. In this case, it was to suppress voter turnout to help their candidates win an election. Now, I don't have any connection to the Netflix documentary, but if you guys want to check that out, they did make a documentary about this. And Netflix is, and the 1984 is not the first time this happened. People have been using bioagents for war long before people understood microbiology. In fact, the earliest documented case that I'm aware of is the Hittite plague, where the Hittites sent infected rams with tularemia toward their enemies and used biowarfare back then. And ancient peoples pretty much knew that if you took dead things or feces and you threw it at people who were not dead or who are not sick, those people tended to get sick and die. And this has been known, as you can see, these are many examples throughout history. And I highlight the one from 1650 because that was particularly creative, to get saliva from rabid dogs. I would not want to be the Polish soldier who had to go and collect that saliva, especially in the pre-rabies vaccine era. But as you can see, people knew if you took stuff from sick people and put it near healthy people, they get sick. And this list could go on and on to the modern day. Now, in our time, probably the most famous was the Amerithrax or anthrax investigation, where envelopes were sent to postal workers. And while fewer people were sickened compared to the 1984 attack, several people did die. So this was much more lethal type attack. And so when we're talking about bioterrorism, I just want to give you guys a sense of a little bit of the history. This is not a new thing. This has been going on for a long time. And while the goal may be maximum morbidity and mortality, often it might not be. It might be a targeted assassination. That's been done before. It might be suppressing voter turnout. It might be a variety of things. And again, it doesn't have to be the exotic, anthraxes and Ebolas of the world for these diseases to cause particular strain on public health resources and to be a big issue. So considering all that, what are the agents of concern? And I wanted you to put your evil hat on right now and think like your favorite supervillain. If you were trying to conduct a bioterrorist attack, what characteristics of the bacteria or viruses would you want to use? Well, some things you might consider is how easy is it spread from person to person? And sometimes you want person-to-person spread. Sometimes you don't if you're trying to do a targeted assassination, right? So that's one factor that might go into it. The other is, well, how deadly is it if someone does get sick? Are they just going to get a little sick and maybe stay home for a day, or are they going to die from this? How easy is it to handle the agent without infecting yourself? And it is entirely possible, and you have to consider this as a first responder, that the perpetrator or the bad guy might be a patient because they may have sickened themselves with whatever they were messing around with. And that's something to consider as well. And so the Centers for Disease Control has sort of thought about these characteristics, and on the CDC website, they group bioterror agents based on category, based on certain characteristics that those possess. So I'm going to review the categories with you guys. And so the first one is category A, and you can think of this as like the greatest hits of bioterrorism. These are easily disseminated from person to person, have high mortality rate, major public health impact, can cause panic and social disruption. A lot of times the fear is worse than the actual disease, and also requires special action for public health preparedness. So these are the really bad guys. And who's on this list? This is your anthrax, your botulism toxin, plague, smallpox, tularemia, and the viral hemorrhagic fevers, which you could think of Ebola as a classic example, a representative example. Now, what about the B list? The category B ones are moderately easy to disseminate, moderate morbidity, probably low mortality, but they do require some specific CDC steps to be taken for diagnostics and surveillance. And so who's on the B list? Well, this is where the food safety threats like salmonella come in. Now, I also highlight under salmonella their glanders. So not all bioterrorist attacks are against people. Glanders actually infects horses. And in fact, one of the biggest attacks in the United States was against our horses in World War I. And I also just highlight ricin there because ricin is a toxin, but it was actually used in targeted assassinations before. And the water safety threats are on here too. And so it doesn't always have to be, you know, the sexy pathogens from the A list. Sometimes common pathogens can cause big problems. Now, what about category C? Category C is an interesting category. It includes emerging pathogens that may be, dangerous in the future. These are also pathogens that are often easy to get, easy to produce, easy to disseminate, and they have potential for high morbidity and mortality. They're just the newer players in the game, and these are like Nipah virus and hantavirus, for example. So just to summarize here, so the CDC groups bioterror agents into 3 categories, A, B, and C. And that takes into account ease of spread, lethality, and need for special countermeasures. And I've only given you a sprinkling of information right now, and I highly encourage you to check out the CDC's website, as it has a lot of great information on all these pathogens. So this is where I want you guys to really pay attention, because I think this is the key thing as an EMS provider, is how do you recognize that an attack is even happening? No one tends to call 911 and says, hey, I think there's a bioterrorist attack going on. Typically not. And so you need to just kind of recognize some illness patterns. And I'm going to tell you a little bit about the major kind of A-list players, because those are the most lethal, and those are the ones you might need to take special precautions and things like that. And so let's learn a little bit about each of these. So why do I have a picture of mud to start? I'm telling you this because sometimes it's as clear as mud in identifying these agents, because they often mimic other diseases. So if we look at most of the symptoms of the A-list pathogens, a lot of them will cause flu-like illness, a lot of them will cause pneumonia, a lot of them will cause rashes, and a lot of them will cause sepsis. Now, there's a lot of non-bioterror agents that do all those things, and you probably see those every day. What's going to clue you in is if you start seeing some system-wide effects. Dead animals, always bad thing. If for some reason, all of a sudden, everyone's super sick and the quantity of super sick people is high, that's a clue. If multiple hospitals are reporting this, that's a clue. If you're getting it from multiple different EMS agencies, that's a clue. So look for those clues. And then here we're going to get into some of the specific diseases. So let's talk about anthrax. So anthrax, it's in the soil everywhere, so it's pretty common. It often infects wildlife or sometimes domestic animals. And the way it gets into you is several different ways. So cutaneous can get in through a skin break. So you can get anthrax through a cut in your skin handling spores. Injection is mostly a problem in IV drug users, and that has been seen in IV drug users in Europe. But the form that most people worry about is inhalation. If you inhale the spores and it gets in your lungs, that's the most serious. And you can also get this from eating undercooked infected meat. So what are the signs and symptoms? The signs and symptoms really depends on how you got infected. Cutaneous anthrax causes bumps, which progress to these black sores that you see here. Injection anthrax causes abscess. So these are going to look like bumps on the arms at injection sites. Pulmonary anthrax is the most concerning, and that's going to look like someone who has pneumonia, chest pain. It might also be vomiting. And the gastrointestinal form often has vomiting, which can often be bloody, and diarrhea as well. Now, there are some lab tests we can do in the hospital for this, and the treatment is going to be antibiotics. Now, you guys are not going to be doing antibiotics in the field. The only reason I mention it is because if you're exposed to this, you may need to take the antibiotics as a prevention, so post-exposure prophylaxis. And most of these are going to be Cipro, Doxy, or gentamicin. So if you have allergies to any of those, that's important to know, because if you are inadvertently exposed to one of these, you may need to take antibiotics as a preventative. And as you can see, for anthrax exposure, it's a pretty long prevention period of 60 days. Now, what about tularemia? So tularemia can be transmitted through insect bites. So the ticks and flies you see here, it can be transmitted through infected animals, typically rabbits or rodents. You can eat it if you eat infected animals. And it's funny, the CDC actually has a picture of this guy mowing the lawnmower. It's directly from the CDC website. And the reason they have it there is apparently you can also get this if you run over a dead animal with your lawnmower and cause it to like aerosolize the spores into the air, and then you can breathe it in. So don't run over dead animals with your lawnmower. The good news is, and I have seen cases of tularemia and they end up not being a big deal. Why? It's because there's no person-to-person transmission. So you can't get this one from your patients. So this one's much less dangerous for you as the EMS provider per se. Now, how can you recognize this? Typically, it causes non-specific symptoms. So fever, chills, headache, cough, nausea, vomiting, abdominal pain. Again, non-specific. Some of the specific stuff you could look for are these lymph nodes. You can see this guy's neck. He's got that big bulge there. That's the lymphadenopathy. The case I saw had oculoglandular symptoms, and the patient was dramatically photophobic, meaning could not look at light at all, was like covering eyes, sitting in dark room. So it really is painful to the eyes. They can have a pneumonic form, which is like pneumonia, and a typhoid form, which is going to be like a diarrheal illness. You can also see the ulceral glandular form down here with that skin ulcer there. And so that can be seen as well. Bunch of tests we do in the ER in the hospital. And again, Doxy and Cipro are going to be your antibiotics here. And if you are somehow exposed, post-exposure prophylaxis can be given, typically only 2 weeks for this one. Now, what about plague? Plague is in those dang prairie dogs. It's mostly in the western U.S. and its natural reservoir. It can you can get it through flea bites or through infected animals. Importantly, though, only the pneumonic plague with droplet transmission can be transmitted person to person. So that's really important. So what are the signs and symptoms? Well, it depends on the type you have. There's bubonic plague with those buboes, which are those bumps. Septicemic plague, you can see with sepsis and discoloration of the extremities here. And then pneumonic plague, which presents like a pneumonia. Again, diagnosed in lab tests in the ER. And again, this is going to be antibiotics, typically Cipro, gentamicin as well can be used. There is post-exposure prophylaxis with a fluoroquinolone. That's typically your ciprofloxacin or levofloxacin antibiotic. And that's what's important for you guys if you do get exposed, to make sure you follow up for prophylaxis. What about smallpox? So smallpox is eradicated in the wild due to this guy inventing the smallpox vaccine. However, a lot of people nowadays are not vaccinated. Most of, at least my generation was not routinely vaccinated anymore. So it could be a concern if it comes back. Now, because there is no natural reservoir of smallpox, if you see a patient with smallpox, that's a bad actor until proven otherwise. So mainly transmitted by droplet inhalation or contact with infected materials. You can see some images of what it looks like here. The key thing is it's a rash and it's got vesicles or pustules in the same stage as development. There's some lab tests we can do. Treatment's mainly supportive. Vaccine is the best to prevent, and there are a couple antiviral meds available for it. I mention these because tecovirimat, which is FDA approved for this, is also what we've been using for monkeypox, which is a cousin of this. virus. So something to just know about there, especially because we have had monkeypox recently going around. So, and what about botulism? So botulism, in particular the toxin, is actually one of the most potent toxins on Earth. It's found in soil. It's also in agricultural products like honey, and can be found in animal intestinal tracts. It can grow in improperly canned foods, hence the pictures here. And it can be inhaled, so it can be spread like an aerosol in a terrorist attack. Can also be foodborne, or it can get into wounds. And there is also iatrogenic, and you might see this. So what does iatrogenic mean? That means caused by medical care. So if someone gets too much Botox or Botox misses or something, their Botox shot, that's botulism toxin. And so you could see actually botulism poisoning from Botox gone wrong. Now, occasionally we'll see this in the hospital with some botulism kids. They often are the floppy baby like you see here, and it's because they get this descending paralysis and they appear flaccid and kind of floppy. They also get these palsies in their face, and this is a clinical diagnosis. If you suspect this, you need to get the patient to the hospital so they can get the antitoxin for this. And with the antitoxin, they usually do okay, but this is serious if not treated. What about Ebola? Ebola makes a lot of headlines because of its mortality rate, but Ebola is primarily found in sub-Saharan Africa. It does infect wildlife, including bats and apes, antelopes. It's mainly transmitted either through the infected animal or from other people in contact with their infected body fluids. Notably, this includes sweat and saliva, and vomit, which is relatively uncommon. So that's important for Ebola, and really Ebola requires special PPE. So if you suspect someone has this, I'll show you the PPE you'll need. But so Ebola in the beginning is going to be non-specific symptoms, just fever, body ache, sore throat, and then later you'll get this nausea, vomiting, and unexplained bleeding, which gives it the name of hemorrhagic fever, is the unexplained bleeding. It can be diagnosed, in the hospital in a variety of lab tests, and the treatment is primarily supportive. There are recently some approved medications. These are pretty new. I've listed them here. And you can see me in this photo. So I'm part of the bioresponse team, and I practice wearing the Ebola suits. And you wear like a special suit with a PAPR, which is a powered air purifying respirator. So that's filtering the natural air. And at least when I was doing EMS, I was not trained to use this, but we are trained to use this in the hospital. There are certain ambulance agencies that are given specific training about this, especially if they know they're going to transport one of these patients. But if you guys are interested in this kind of PPE training, let me know, and maybe we can set up something special, and I can do maybe a demo of this. So this is a key slide here, and if you forget everything else I told you, I want you to kind of just know like the precautions you need to take to protect yourself from any of these agents. So now you'll see on this list here, a lot of them say standard precautions. Standard precautions means the precautions you would take for every patient. Those are things like gloves, eye protection, mask, right? The standard universal stuff, nothing special, okay? So for anthrax, if it's a skin anthrax, cutaneous, you need to take contact precautions. That's gown, gloves, eye protection. Pulmonary infection is going to be the same thing. That includes mask, so you need definitely a surgical mask. And GI infection is going to be the same, gloves, gown, mask. Botulism, you just kind of need gloves. Mostly it's the toxin, so it's hard to transmit that person to person. Plague is going to be standard and droplets. That includes surgical mask. I would recommend N95 just in case they aerosolize. Some experts do recommend it. I think you can't go wrong with that. Smallpox, you need that N95. You must have airborne precautions for smallpox. Tularemia, remember, no person-to-person transmission, so you're just going to need standard precautions there. And the hemorrhagic fevers also do require airborne precautions with the PAPR, or if you have nothing else, an N95 at least. You really want to seal yourself off against all body fluids with the hemorrhagic fevers. And if you're interested in that kind of PPE demo, let me know. Maybe we can set up something special. These are some of the references I refer to in this slides here. Thank you guys for listening in. I hope you found this a little bit interesting, at least, to understand some of the history behind this and some of the types of bacteria that are the most dangerous, and hopefully at least gave you a sense of when you need to go for post-exposure prophylaxis. That's antibiotics if you're exposed, and also have a better sense of what precautions you need for each type of the A-list agents. And so I hope it's at least a little bit helpful, or if not helpful, at least interesting. And if you're interested in more of a PPE demo or something like that, let me know, and maybe we can schedule something, a special demo or something like that. Thank you guys. Stay safe out there. See you on the next one.